Urinary incontinence, the unintentional leakage of urine, is one of the most common yet often overlooked problems among older women. It can occur due to age-related weakening of pelvic floor muscles, hormonal changes after menopause, certain medical conditions, or as a side effect of medications. While it may start as a minor inconvenience, ignoring urinary incontinence can lead to persistent hygiene problems, skin irritation, and the development of a strong, unpleasant urine odor that affects both personal comfort and social confidence. One of the reasons older women ignore this issue is embarrassment. Many feel that it is a normal part of aging and therefore something they just have to live with. This mindset prevents them from seeking help or using available management strategies. Over time, small leaks throughout the day can cause underwear and clothing to retain moisture, creating the perfect environment for bacteria to grow. This bacteria, combined with the ammonia in urine, produces a pungent smell that becomes noticeable to others. Addressing urinary incontinence early can make a huge difference. Medical consultation is the first step. Doctors can determine whether the incontinence is stress-related, triggered by coughing, laughing, or physical activity, a sudden, intense need to urinate, or mixed. Treatment can include pelvic floor exercises, Kegels, bladder training, prescribed medications, or in some cases, minor surgical procedures. In addition to medical intervention, lifestyle changes can significantly improve the situation. For example, wearing absorbent pads or liners specifically designed for urinary leaks can help trap moisture and neutralize odors. These products are different from menstrual pads. They are made to handle urine's chemical composition and prevent smell more effectively. Changing them regularly is essential to avoid prolonged exposure to moisture. Choosing breathable, cotton underwear also helps, as it allows air circulation and reduces bacterial growth. Dietary adjustments can play a role too. Reducing bladder irritants like caffeine, alcohol, and acidic foods may decrease leakage episodes. Drinking enough water, counterintuitively, is also important because concentrated urine has a much stronger smell. Many women mistakenly reduce their water intake to avoid leakage, but this actually worsens the odor problem. Ignoring urinary incontinence not only affects hygiene but also impacts self-esteem. Women who experience odor or fear leakage may limit social activities, avoid exercise, or even withdraw from family gatherings. This isolation can have mental health consequences, including increased feelings of depression and anxiety. By acknowledging the problem, seeking appropriate medical advice, and implementing simple hygiene practices, older women can manage urinary incontinence effectively. This not only prevents urine odor, but also restores comfort, dignity, and confidence in everyday life. It's important to remember that incontinence is common, treatable, and nothing to be ashamed of. The key is to take action rather than silently endure it. The choice of underwear may seem like a small detail in daily life, but for older women struggling with freshness and odor control, it can make a big difference. Synthetic or non-breathable fabrics like nylon, polyester, and spandex trap heat and moisture against the skin. When this moisture comes from sweat, urinary leaks, or natural, vaginal discharge, it creates an ideal environment for bacteria and yeast to thrive. These microorganisms break down organic matter and release unpleasant odors, including a urine-like smell that becomes difficult to mask, even with frequent washing. As women age, skin becomes thinner and more sensitive, and hormonal changes can alter the vaginal pH balance. This makes the genital area more vulnerable to irritation and infection when exposed to dampness and heat. Synthetic fabrics worsen the problem by preventing adequate airflow, which means moisture lingers longer than it would with breathable materials like cotton. This trapped dampness can also lead to skin chafing, redness, and recurring rashes, which further compromise hygiene. Many older women choose synthetic underwear for its appearance or because it feels smooth and stretchy, but they may not realize the hygiene drawbacks. Another common issue is wearing tight-fitting underwear, which restricts airflow even further and increases the risk of odor and infection. Even if leakage is minimal, synthetic underwear tends to absorb and hold on to urine molecules, making the smell more noticeable throughout the day. The solution is to opt for underwear made from 100% breathable cotton or cotton blends with minimal synthetic content. Cotton is highly absorbent and allows air circulation, keeping the genital area cooler and drier. Some modern cotton underwear options are designed to be both functional and stylish. so comfort doesn't have to mean sacrificing appearance. For women who still prefer certain synthetic fabrics for their look or feel, wearing them for short periods, such as during an evening event rather than all day, can help reduce the risk of odor buildup. It's also important to change underwear at least once a day, and more often if any leaks or dampness occur. Using a mild, fragrance-free detergent when washing underwear helps prevent chemical irritation and maintains the fabric's breathability. Adding a small amount of white vinegar to the rinse cycle can naturally neutralize lingering odors without harsh chemicals. For women who experience frequent urinary leaks, combining breathable underwear with absorbent odor-controlled pads can be highly effective. Pads should be changed regularly to keep the underwear itself dry and clean. Ultimately, avoiding synthetic or non-breathable underwear is about more than just comfort. It's a key step in preventing the accumulation of odor-causing bacteria and maintaining intimate hygiene. With the right fabric choice, older women can reduce unwanted smells, protect their skin, and feel fresher and more confident throughout the day. Maintaining proper genital hygiene is essential for every woman, but as women age, it becomes even more critical due to physical changes like reduced estrogen levels, thinner skin, and a higher risk of urinary incontinence. Poor genital hygiene can quickly lead to the buildup of bacteria and ammonia from urine, resulting in persistent odors, often described as urine-like, along with discomfort and potential infections. One of the most common mistakes is infrequent washing or not cleaning the genital area thoroughly after urination or leakage. Small amounts of urine that remain on the skin or hair can dry and release odor over time. If this happens repeatedly, the odor can become difficult to eliminate, even with regular bathing. On the other hand, some women overcompensate by washing too aggressively or using harsh soaps, which strip away the natural protective oils and disrupt the pH balance of the vulva. This can cause dryness, irritation, and make the area more susceptible to bacterial or yeast overgrowth, further worsening odor problems. Another overlooked issue is wiping incorrectly. Wiping from back to front after using the toilet can transfer bacteria from the anal area to the urethra and vagina, leading to urinary tract infections, UTIs, and unpleasant smells. The correct method is always to wipe from front to back to reduce contamination risk. To maintain optimal hygiene, older women should wash the external genital area daily with lukewarm water and, if needed, a mild, unscented pH-balanced cleanser designed for intimate use. Harsh antibacterial soaps, scented gels, and strong cleansers should be avoided as they can disturb the natural microbiome. Importantly, the internal vaginal canal should never be washed or douched. The vagina is self-cleaning, and such practices can cause more harm than good. After urination or incontinence episodes, gently patting the area dry with soft toilet paper or unscented wipes can help prevent moisture buildup. Moisture is the primary cause of odor, since it allows bacteria to multiply. Using breathable cotton underwear and changing it whenever it becomes damp further supports cleanliness. For women with mobility issues or those who cannot bathe daily, perineal washcloths or Norin's intimate cleansers can be an excellent option for maintaining freshness in between showers. Bedbound women or those in assisted living should receive help from caregivers in keeping the area clean and dry, as neglect can quickly lead to strong odors and skin breakdown. Ignoring proper genital hygiene not only affects odor control, but can also lead to repeated infections, skin irritation, and social embarrassment. Good hygiene habits, combined with the right products and techniques, can dramatically reduce urine-like smells, improve comfort, and restore self-confidence. When approached with consistency and care, genital hygiene is not just about staying fresh, it's an essential part of overall health and dignity for older women. One of the most overlooked causes of urine-like odor in older women is delaying the change of pads, liners, or absorbent undergarments. While these products are designed to capture moisture and control odor, they have a limited capacity. Once saturated, they no longer effectively lock in liquid, and the trapped urine begins to break down into ammonia, producing a strong and unpleasant smell. Prolonged exposure to moisture also creates the perfect environment for bacterial growth, which can further intensify the odor and cause skin irritation or infection. Many older women delay changing pads or liners for several reasons. Some may want to save money by using fewer products each day, while others may simply underestimate how quickly these absorbent materials become full. Mobility issues or embarrassment can also make frequent changing It might seem logical to reduce water intake in order to prevent urinary leakage, but for older women, drinking too little water often makes urine odor much worse. When the body is dehydrated, urine becomes more concentrated, meaning it contains a higher level of waste products like urea, ammonia, and salts. This concentrated urine has a much stronger smell, and when even small leaks occur, the odor is more noticeable and difficult to control. Many women, especially those who deal with urinary incontinence, intentionally limit their fluid intake to avoid frequent bathroom trips or accidents. While this may temporarily reduce the urge to urinate, it creates a long-term hygiene problem. Concentrated urine not only smells stronger, but can also irritate the skin, increasing the risk of rashes, itching, and even urinary tract infections. Dehydration also affects bladder health by making the bladder lining more sensitive and prone to inflammation. Adequate hydration helps dilute urine, reducing both its odor and its irritating effects on the skin. Water also supports kidney function, helping to flush out toxins and bacteria from the urinary tract. Without enough water, bacteria can multiply more easily, which can lead to infections that cause even stronger and more unpleasant smells. For most older women, a good hydration target is about 6 to 8 glasses of water per day, though individual needs can vary depending on activity level, diet, and medical conditions. It's important to spread water intake evenly throughout the day rather than drinking large amounts at once. This approach keeps urine consistently diluted while avoiding sudden bladder overload. Some drinks, however, can make odor problems worse. Caffeine in coffee, tea, and some sodas and alcohol act as diuretics, which increase urine production and may contribute to dehydration. Certain foods and drinks, like asparagus, onions, and strong spices, can also change urine's smell. While these don't need to be completely avoided, being aware of their effects can help women make better choices, especially before social events. Thought for those worried about nighttime leakage. It's best to maintain normal hydration during the day and reduce large fluid intake in the 2 to 3 hours before bed without cutting water out completely. This allows for adequate hydration while still minimizing nighttime bathroom trips. Another useful tip is to incorporate water-rich foods into the diet. Fruits like watermelon, oranges, and strawberries, and vegetables like cucumber and lettuce contribute to hydration while providing essential vitamins and minerals. Herbal teas without caffeine can also be a pleasant way to increase fluid intake. In summary, drinking too little water is a mistake that often backfires when it comes to managing odor. Proper hydration is one of the simplest and most effective ways to keep urine odor mild, support urinary tract health, and maintain overall well-being. Older women who stay well hydrated are far more likely to feel fresh, comfortable, and confident in daily life. Improper washing of underwear and clothes is one of the hidden but significant causes of persistent urine odor in older women. If personal hygiene is maintained, wearing garments that are not thoroughly cleaned can reintroduce odor-causing bacteria to the skin and create a constant cycle of unpleasant smells. This problem often occurs because urine residue, sweat, and natural body oils can cling to fabrics, especially underwear and incontinence garments, and may not be fully removed with quick or low-temperature washes. Older women dealing with urinary leakage may have small but frequent damp spots on their underwear or clothing throughout the day. If these garments are not washed promptly or properly, bacteria multiply and break down urine components into ammonia, producing a strong and lingering smell. Over time, the odor can become locked into the fabric fibers, making it harder to eliminate even after multiple washes. A common mistake is washing underwear with regular laundry at low temperatures. While this may seem convenient, it's often not enough to kill bacteria or remove odor completely. Synthetic fabrics, in particular, tend to hold on to smells more stubbornly than cotton. Using fabric softener can also worsen the problem, as it leaves a coating on the fibers that traps odor inside. To prevent lingering smells, underwear and incontinence garments should be washed separately from other laundry, ideally in hot water if the fabric allows, with a mild detergent. Adding white vinegar or baking soda to the wash cycle is an effective natural method for breaking down urine salts and neutralizing odors. Vinegar helps kill bacteria while softening the fabric, and baking soda is a natural deal for particularly stubborn odors. Pre-soaking underwear in a vinegar water solution for 30 minutes before washing can help. Drying is just as important as washing. Damp fabrics can quickly develop a musty smell, which mixes with any remaining urine odor to create an even stronger scent. Whenever possible, dry underwear in direct sunlight, as UV rays have natural antibacterial properties. If using a dryer, ensure the items are fully dried before storing them. It's also worth noting that old or worn underwear may never smell completely fresh, no matter how well it's washed. Fabrics lose their ability to release odors over time, so replacing underwear every 6 to 12 months is a good hygiene practice. For women who use reusable incontinence underwear, following the manufacturer's specific washing instructions is essential to maintain both absorbency and odor control. Ultimately, improper washing habits allow odor to linger and undermine other hygiene efforts. By adopting thorough cleaning routines, using odor-neutralizing techniques, and replacing old garments regularly, older women can break the cycle of recurring smells. Fresh, clean underwear and clothing not only improve personal hygiene but also restore a sense of confidence and comfort in daily life. Many older women believe that using strong, heavily scented soaps or antiseptic cleansers will keep them feeling clean and odor-free. Unfortunately, this approach often has the opposite effect. The skin around the genital area, particularly the vulva, is delicate and protected by a natural balance of good bacteria and a slightly acidic pH. This balance helps prevent the overgrowth of odor-causing bacteria and yeast. When harsh soaps, body washes, or disinfectants are used regularly, they strip away the skin's natural oils and disturb this pH balance, leading to dryness, irritation, and increased odor over time. The vagina itself is self-cleaning and does not need internal washing. However, many women, influenced by misconceptions or advertising, resort to douching or using strong cleansers inside the vaginal canal. Douching disrupts the vaginal microbiome, killing the healthy bacteria like lactobacillus that help control harmful microbes. This disruption can cause bacterial vaginosis or yeast infections, both of which often produce a strong, unpleasant smell, sometimes mistaken for a urine odor. Even washing the external genital area too frequently with antibacterial soaps can be harmful. While it may seem like frequent washing would prevent odor, overwashing actually removes the protective layer of moisture and allows irritants or bacteria to affect the skin more easily. Irritated skin is also more prone to trapping odor-causing substances like urine or sweat. The key to intimate hygiene is gentle care. Older women should use mild, unscented, pH-balanced cleansers that are specifically formulated for the vulva. These products are designed to clean effectively without disturbing the natural acidity of the skin. For many women, plain lukewarm water is enough for daily washing of the external genital area, with cleanser use limited to a few times per week or after heavy sweating or incontinence episodes. Another important habit is rinsing thoroughly. Residual soap left on the skin can cause dryness, itching, and irritation, which may worsen odor problems. After washing, the area should be gently patted dry with a soft towel to prevent moisture buildup, as dampness encourages bacterial growth. Fragranced products, even if marketed as feminine hygiene solutions, should be avoided. This includes perfumed sprays, powders, and wipes, which can mask odor temporarily but often cause irritation and further disrupt the natural balance, making the underlying issue worse in the long run. For women experiencing persistent odor despite gentle hygiene, it's important to consult a healthcare provider. In some cases, an underlying infection, urinary incontinence, or skin condition may be contributing to the problem. Treating the root cause, rather than just trying to mask the smell, is the most effective way to restore freshness. In short, using harsh soaps or strong cleansers is a common but avoidable mistake. By switching to gentle, pH-balanced products, avoiding unnecessary douching, and practicing careful rinsing and drying, older women can maintain healthy skin, protect their natural defenses, and reduce odor, all while avoiding the discomfort and damage caused by overly aggressive cleaning methods. Many older women overlook the importance of regular medical checkups for urinary and bladder health, often assuming that issues like frequent urination, mild leakage, or occasional odor are just normal parts of aging. While some bladder changes are indeed common with age, persistent symptoms, especially those involving urine odor, can indicate underlying health problems that require professional attention. Neglecting these checkups allows small, treatable conditions to develop into chronic or more serious issues, Urine-like odor in older women can be linked to a variety of medical conditions. Urinary tract infections (UTIs) are among the most common.